Welcome again to our course on biodesign, strategies for innovation and design on bioengineering. Today we're going to take a brief look to our sales and distribution strategy model. So let's start. For today's class, the objectives are to appreciate the impact of the company's business model and other essential factor on its options for reaching customers, meaning indirect or direct sales, as well as other distribution models. I want you to understand the most common medical device indirect sales and distribution options and how they can work, as well as understanding how direct sales model works in this industry. Finally, I want you to learn how to determine the most appropriate sales and distribution model for you. If we think about sales and distribution model, one of the very first things to actually revise is your business model impact on sales. If we remember some previous presentations on this module, we can see that there were 8 basic models for business in the medical device industry. Not to say that there could be others. These 8 are disposables, reusables, implantables, capital equipment, services, fee per use, over-the-counter products, prescriptions, and physician sales. Why it's important to revise these business models? Because they are all different in different characteristics in terms of margin structure, sales investment, importance of intellectual property, barriers to entry, customer training, clinical hurdles, and financial requirements. As such, your financial and business model will be critical in determining your sales and distribution strategy. Because, for example, if you use a reusable business model, then that means that your sales investment may be really low. But if you use, on the other side, a capital equipment or an over-the-counter business model, then your sales investment is going to be way higher. And that's going to determine the type of sales force that you are going to need. If we think about all these different variables, at the end we can distribute in a grid the 4 different types of sales force models that we can have depending on the number of users and the value of the product. If the number of users or the device count that you're going to use or sell is really high, then you're probably going to be talking about national distributors or direct sales forces. That's going to depend on the product value, but for example, if the product value is low, then national distributor sales force model is going to be the thing to follow. At the end of the day, it only suffices to say that direct sales forces are specifically tailored for products of great value, and national distribution systems are tailored for products of low value. And this is directly related to the type of relationship that these distributors or salespersons are going to have with the customers. In products of less value, you don't need to be as keen on customers as in low value products. But in terms of that, then it is important to just acknowledge that it all depends on product value. In terms of number of users, it could be a little bit more heterogeneous, but it only suffices also to say that if you have a product with a very low number of users and also a value that is not really widely acknowledged, then you are looking for a specialized distribution system. In this case, it is very important to notice that a business model such like implantables might be of great importance to find specialized distributors options in these schemes. In terms of deciding a model for sales, there are different algorithms that we can use, and here we're proposing one, and it's only important to recognize that it all depends on the answering of questions, of 3 important questions to actually think or decide for a different type of distributor or force for sales. In this sense, the questions of most importance are complexity and how expensive is the medical device, if it is expensive or not, or complex or not, the volume that you want to manage, how many of these devices are actually required, it's a high volume or low volume, and of course at the end of the day, the funding sources and how your portfolio supports this force. In this case, third-party manufacturers, hybrid models, direct sales force, specialized distributors, and national distributors. It will range from these questions in the different phases that they can take. So if we think at the end of the day, what is going to be the steps, or what is going to be the most important things to actually do in order to perform a sales strategy? Well, first you have to again evaluate the impact of your business model on the options for reaching the customers. That means that depending on the business model that you want to have and that you think you could have, you have to explore what the variables on margin, sales investment, IP importance, barriers to entering, customer training, clinical hurdles, and financial requirements are in order to assess these variables to locate the most viable and effective sales force or distribution model for your product. Secondly, you have to assess the impact on intermediaries on sales and distribution. Sometimes it's going to be beneficial to have intermediaries because you want to target a customer pool or a nation that you don't know really well. But on the other side, that's gonna also bring up the price point of your product. And if that's something of great importance to you, then that might be something of great relevance to consider. Third, you want to choose a sales and distribution model from this decision tree and algorithms, and just try to decide for one. And finally, to coordinate the marketing, training, and support activities that you're going to need to actually execute this sales and distribution model. And with this, we have concluded our module on sales and distribution strategies. For more information, please take a look at our biodesign book. My name is Luis Sorensen, and thank you for watching.